Aquis-listed ProBiotix Health was established by ProBiotix Health Plc to develop probiotics to tackle cardiovascular disease and other lifestyle conditions which are affecting growing numbers of people across the world. Since its creation, ProBiotix has become a global leader in specialist probiotics for use in foods, supplements and other therapeutics, biotherapeutics. Stephen O'Hara is the founder and non-exec director at the company, and he joins us now on the line. Stephen, it's good to be able to catch up with you again. I want to get into more details about you and your background behind this, but explain more about what it is that you're doing with ProBiotix Health.
So probiotics are bacteria that have a health benefit. Most people will be familiar with probiotics in yogurts, where it's been established for many, many years. They have a health benefit. And other companies focus very much on gut health and general health and well-being. When I started ProBiotix, which is the parent company of ProBiotix a number of years or so ago, I developed both a probiotics and a prebiotic platform. I wanted to create a probiotic that met an unmet need, a large unmet need. And if you take cardiovascular health, so cardiovascular disease will kill about a third of us. And if you then look at the treatments to reduce cardiovascular risk, they are quite difficult, because while statins are very good as a product, about a third of people who take a statin will come off the statin after a year. This is WHO criteria because of side effects. So there was clearly a large market there, and there was clearly an unmet need for a product that was safe, so it didn't have the side effects of statins, and was efficacious. And that's what we created in ProBiotix Health.
And how far down the route are you to getting these products approved? What is the approval process? Because, as you say, we know about probiotics in yogurt, for example. How are you applying these, and what sort of hurdles are there to get them approved?
There's quite a few hurdles, so let's just sort of go through it in sort of a stepwise process. The first step is to understand the science and how a product works. So we had to build the science and understand how our product works and the mode of action. We're very clear on that. We published on that, and that's important because you can understand then how to combine various ingredients with your particular product. And it's also very important who want to take on your particular product. The second thing you have to do, you have to make sure that the product works and is safe. So you go through clinical studies. So we've gone through 3 clinical studies, and they're all independent clinical studies that show our product is safe and efficacious. The third thing you have to do is obviously manufacture it to high scale and in a way which is very consistent, so you have the same product each time. And we've been doing that now for about 8 years. And then you have to then take the product and put it on the market. And each market across the world, and the Europe, and people think of Europe as being a consistent market. It's not. You have to go through various regulatory hurdles in each of those markets to establish the product either as a supplement or as a food. And we've gone through all those particular processes to make sure that we have a product that is safe and is efficacious, and we formulate it in a range called microbiome in 4 different types of product to reduce the risk of various aspects of cardiovascular health. So we've got a product to reduce cholesterol, and we've got a product to reduce blood pressure. We've got a product that reduces impacts on cardiovascular risk by reducing the buildup of plaques in the arteries. And we've got another product that is more generic. So that range then fits the needs of all the countries around the world in terms of products, but also gives a product range that we can share with various partners and customers around the world.
So are we talking here about products that are just associated with food as a supplement, or are you also going down the route of bringing about something that's going to be a prescription medication which is prescribed by the medical community?
Yeah, so there's 3 routes actually. The first is a supplement, okay? And that's been our focus. The second is to incorporate a probiotic into food, like a yogurt. And that requires a different level of regulatory oversight, because of course you're including something in a yogurt, for example, that reduces cholesterol, but people may buy that particular product with normal levels of cholesterol, so you have to show your product doesn't reduce cholesterol in people who have normal levels of cholesterol. But we've gone through a process, a very complex process, and we've got what's called FDA GRAS. And GRAS stands for generally regarded as safe, and that's been approved in the US. Okay, and we're really now starting to focus on the food area, particularly in terms of yogurt. We've got a number of products around the world, particularly in South America, where we have companies taking our probiotic into yogurt. And the third area is a biotherapeutic. We tend to avoid that particular route because the costs associated with it and the high regulatory barriers, but we do have a partner who's taken our probiotic LPLDL down that particular route. But I have to say, I've said all the way along, this is a high risk route, and many companies, and people will be familiar with 4D Pharma, who haven't succeeded on that route because of the cost and time it takes.
So to confirm, you are revenue generating, aren't you?
Yeah, we've been doubling sales every single year since we've launched the company. In 2021, we did £1.1 million worth of revenue. That's been reported. Last year, we increased our sales by about 30% and grown quite rapidly. And even more interesting, and this is before the impact of our new CEO. By the second week of February, we had just under £500,000 worth of orders for 2023. So you can see that this is really scaled up very, very quickly. So this is a rapidly growing business, and that's because people are becoming more aware of the value of supplements. Many people use supplements during COVID, and people becoming more aware of the science and the proven science behind supplements, and taking these products and finding success. So when we get customers who use our products, we sell direct on the online store, we have a 95% retention rate. So people who take our products stick with them, and it's a wonderful product, and we get some wonderful results. So most people reduce their cholesterol by between 30 and 40% using our products. That's as good as many statins.
What happens now? Do you start to rake in some big profits after you've got this market established? And I guess as you grow and the distribution increases, that's when the really big profitable business starts to kick in. From your experience about establishing companies and making them profitable, where do we go from here? What do you say to investors about the future? I think on your website you talk about big commercial opportunities in 2023. So I guess this is all part of the same thing about where the company's going and the trajectory of profitability.
Yeah, so we're profitable now. We're profitable in 2021. We'll be profitable in 2022. And we'll certainly be profitable in 2023. So it's very important when you build a company to try to get to profit as early as possible, because in doing so, you can then be self-sustaining, and you're only taking investment income to grow to the next level. So in terms of the next level, we appointed a new CEO. So I was the CEO of ProBiotix Health Plc on the AIM market and ProBiotix Health Plc on the Aquis market last year, which clearly is not sustainable because you get conflicts. So I appointed Steen Anderson as CEO of ProBiotix, and he started in January. We spent the first 6 to 8 weeks getting Steen up to speed in terms of understanding the science, understanding the products. And what he brings, if I sort of take you through the process in relation to your question, is that what I'm really good at, all the things we discussed earlier, proving the science, getting the clinical studies proven, getting the regulatory approvals, getting the company to profitability. What you want next is a true dyed-in-the-wool salesman to lead the company. And so we brought Steen in. He is a real salesperson. He will take this company to the next level. And I can see, if I look at the market, and I look at our market capitalization, we are very, very undervalued. And if you look, as I said earlier, at our sales revenue, if you look at our profitability, I could see this really being worth 20 20 to 30 to 40 million this year. Really could.
Which is 3 or 4 times where we are at the moment. What about the listing? You say this is listed on AQSE. Why AQSE? I mean, we know it is a growth market and it does specialise in small caps, but why particularly the Aquis market?
So I've listed companies on the A market and on the Aquis market, and there's some value in terms of Aquis, and the biggest value is typically to put a company on AIM, it will cost between £750,000 and £1 million. Put a company on to the Aquis market normally costs between £300,000 and £330,000. So it's a good starting point for a company in its growth cycle, whereby if you think we raised 2.5 million, I didn't want to raise 2.5 million and then spend £1 million on putting a company on the stock market. So what it means, it gives us the opportunity to get the company on the market, establish our growth, then we can move on to other markets in the future. I'm sure most people are aware that after you're on the market for 18 months, moving from the Aquis market to the A market is far cheaper and far quicker than doing it stepwise.
You're a very busy man. I mean, you're a microbiologist at heart, I know, with more than, I think, 50 publications behind you. My understanding is you own more than 100 patents. I mean, you've built several companies, as you've explained, taken them through to IPO. You founded ProBiotix 11 years ago, Skin Biotherapeutics, another company I've come across 8 years ago, and now ProBiotix through Optibiotics. How do you find time to squeeze all this in? I have to say, you are, as founder of this business, you are a non-exec direct here. You're not CEO, as you've explained, but there doesn't seem to be an awful lot of time to set aside for all that you do. How do you go about all this?
I think the first thing is I enjoy what I'm doing, so it doesn't feel like work. What I try to do is create products which have value to people. So when you get customers right back to you and said, no, they were on statins and they struggled with statins, they took our product and now their cholesterol has gone down to normal levels. So you know that you had a real impact in their lives. And then that really drives you forward. And just in terms of the companies, Skin Biotherapeutics, I founded, I took it to a level and I brought in a CEO and I brought in a chairman, similar to what I've done in terms of probiotics. So I brought in a chairman, Adam Reynolds, I brought in a CEO, Steve Anderson, and my role now is very much on the corporate side. So whilst I'm a non-executive director, I will do a lot of the corporate side in terms of the interviews, while Steam focuses, I want to keep Steam focused totally on selling this product and building a business. So I'm a non-executive director, look after the corporate side of things, but my focus now going forward will be very much on ProBiotix Health Plc, because that's a company that grew really, really rapidly. It struggled a little bit last year with the downturn, with the issues with the global economic downturn, but now is bouncing back very, very quickly. And that's my focus for 2023, as well as supporting Steen on the probiotic side.
That's a good point. That's a really good point, actually. Do you see what you're doing as insulated, I think is probably a good word, from the economic downturn as we are seeing it at the moment? We've just been hearing about the strains and stresses of consumers. I guess these companies that you founded are pretty insulated, aren't they, from the downturn?
There's two things, really. The first thing is, in any downturn, people will still focus on their health, okay? And particularly something like a cardiovascular health. If you take these products, reduce your risk. If you stop taking them, your risk goes up again, and people don't want to have that risk, so they value their health. The second thing is that a lot of our sales are overseas. So if I take ProBiotix, we sell a lot of product now to the US. We sell a lot, going back to your point earlier, the pharma companies, particularly in Italy, which is the largest probiotic market in Europe and the second largest in the world. So we've got we're not UK centric. But going forward, picking up a point you said earlier, we're trying to do a couple of things. We're focusing very much on what's called D2C, direct to consumer. We sell them direct to consumer, and we got good retention rates. And actually, it's interesting, even though we got a UK website, 20% of our sales on that website in the UK are abroad, with a large number to the US. You can see the US market is quite a big market. So we want to extend our reach into the US, take more products to the US, extend our D2C sales, direct to consumer sales. And of course, if you sell direct to consumer, you get the cash in straight away. Whereas if you sell to a partner, they may want, 1 month, 3 months, or sometimes with larger retail companies, 9 months or a year in terms of when before they pay the invoice. So it's a far stronger position you're in if you go direct to consumer.
One final question. I noticed from the shareholder register you, I think, have 5% shareholding, a little bit more than that, of ProBiotix. Do you, as a rule, keep interest in all the businesses you've listed and you've established?
Yeah, so I put in $500,000 in ProBiotix. I put money in the listing of ProBiotix. I'll add as the opportunity arises when we're not within a period where there'll be announcements. I take a keen interest, not just in terms of leading and involvement in the company, but also in terms of a stake in the company, because I think that's very important for shareholders. So you suffer the pain and you suffer the gain. And typically, and people can look at my record on this, I get 10-20 times return on the companies that I've put on the market. Currently, we're in a very strange market. We're very much in a bear market, but I'm pretty comfortable that with ProBiotix that if you look 1-2 years ahead, this will be worth 40, 50, 60 million. And one other point to add, this industry is a very much a growth industry, is the probiotic industry, and many partners are looking to acquire companies with just like ProBiotix that have the IP, that have the sales, that have the network, have a range of products that have all the regulatory approvals. So I'd be surprised if we don't get an offer from a large player in the next couple of years or so. We certainly have had tentative offers or approaches, I would say, over the last 12 months.
Yeah, that's clearly something obviously that you're going to have to contend with later on. But look, Stephen, we'll have to leave it there. But thanks indeed for joining us. It's been a pleasure talking to you. Stephen O'Hara is the founder and non-exec director of ProBiotix Health, and as we've just heard there, a 5% shareholder in the business.